This broadcast of Education and Perspectives is paid for by Medgar Evers College.
Your presence here today is not just appreciated, but is also crucial as we gather to listen to these experts share invaluable insights on our topic of this week, diabetes awareness.
So this is a lecture that I often give to our medical students and residents. It takes about 3 hours, but we're going to condense it into 15 minutes. So we're going to get through this kind of quickly, but I do want to leave you all with hopefully a little better understanding of what we're talking about today, which is diabetes, a disease which affects all of us. So of course, when we talk about diabetes, different people could have different things in mind. And when we ask what is diabetes, there's a couple of types of diabetes you should familiarize yourselves. There's type 1 diabetes and type 2 diabetes, which we'll define in a moment. There's also gestational diabetes, which is diabetes during pregnancy, but not before or after pregnancy. And then there's prediabetes, which is a condition which can lead to diabetes unless changes are made. There's also other types of diabetes, including genetic types, post-surgical diabetes, diabetes because of use of certain drugs, malnutrition, and infections or illnesses, up to 1 to 5% can be other types. But when we talk about diabetes, usually it's type 1 and type 2. And you should know the difference between type 1 and type 2 diabetes because you should know exactly what type of diabetes you have or your loved ones have, because that can change how you manage the disease. So type 1 diabetes is diabetes when the body fails to make enough insulin. Insulin is the hormone that allows glucose to enter the cells of the body and to provide energy. It's the fuel to make the cells work. And without insulin, glucose can't get into those cells. It stays in the bloodstream, which is why people with diabetes have elevated blood glucose levels, because the glucose is stuck in the blood, can't get into the cells. And when we talk about type 1 diabetes, between 5 and 10% of all Americans with diabetes are actually type 1 diabetic patients. We used to call this juvenile diabetes or insulin-dependent diabetes, but we now know that people can get type 1 diabetes at any age, even though it usually develops in children or young adults. This diabetes type is characterized by a dependence on insulin injections. So if you see somebody with diabetes who's on pills, they probably don't have type 1 diabetes. They probably have the more common type 2 diabetes. Type 2 diabetes is when the body does produce insulin, but it doesn't produce enough insulin to overcome the resistance that the body has. The cells are resistant to the action of insulin, and more insulin is required to move glucose from the bloodstream into the cells. Because the body needs more and more insulin, when the body starts to make less of it, even though it's maybe more than normal, it's not enough that to get the glucose out of the bloodstream and at least the elevation in blood glucose, or what we call a relative insulin deficiency. And most Americans with diabetes are this type 2 diabetes type. We used to call this one adult onset, but number one, we know that adults can get type 1 or type 2 diabetes. And number two, this actually is occurring more and more frequently in younger people, in adolescents, even in children. Although it usually occurs in adults over the age of 40, usually occurs in overweight people and people with a family history of diabetes. But it can occur in anybody. And there are a variety of treatments for this, which include lifestyle interventions, insulin, or other oral or injectable medications. Let's talk a little bit about prediabetes. This is where someone has higher blood glucose than normal, but not high enough to meet that criteria for type 2 diabetes. There are other words for prediabetes, which include impaired glucose tolerance, or IGT, or impaired fasting glucose, IFG. So those are all part of the prediabetes spectrum. Who gets diabetes? Well, unfortunately, more and more people are getting diabetes, and we refer to diabetes now as an epidemic. It really is the disease that affects everybody. As of 2022, 38.4 million Americans had diabetes, which was 11.6% of the U.S. population. And 1 in 5 people with diabetes don't even know they have it. 98 million Americans can be classified as having prediabetes, or more than 1 in 3. And more than 8 in 10 adults with prediabetes don't know they have it. Just to give you an idea of the scope of the problem we're talking about here. This is a picture of the U.S. in 2004 and in 2021, just showing how the incidence of diabetes has really exploded in a relatively short period of time. So the darkest blue regions or counties in the map are between 11.4 and 17.9% prevalence of diabetes in those populations. You'll notice that in the New York metropolitan area on that map, it's also in the darker shades of blue. So certainly we're not being spared from the epidemic like other regions of the country might be. Let's talk a little bit about who is being diagnosed with diabetes. So for both men and women, the prevalence of diagnosed diabetes was highest among American Indian and Alaska Native adults, about 13.6% for those groups, followed by non-Hispanic Black adults, 12%, adults of Hispanic origin, 11.7%, non-Hispanic Asian adults, 9%, and non-Hispanic white adults, 6.9%. So you see the difference between Black population and white population there, between 7 and 12%. 13.1% of adults with less than a high school education had diagnosed diabetes versus 9.1% of those who had a high school education and 6.9% of those with more than a high school education. So highest education level achieved also correlates with an inverse relationship in the incidence of diabetes. And the prevalence was highest among the adults living in non-metropolitan areas compared to those in metropolitan areas. So actually living here in Brooklyn may be somewhat protective, but not that much. This is just a graph that shows the percentage of adults with diabetes here in Kings County, New York, just to show that it's a pretty flat profile. It has increased from 8% back in 2024 to about 10% now, but it's only a slow increase. But it's certainly not getting any better, despite increasing awareness of the epidemic of diabetes and having a lot more tools to manage and to treat diabetes. So even though we have these new generation tools, we're not really getting a lot of results here in Kings County, New York. Let's talk a little bit about diabetes in African Americans. So compared to non-Hispanic whites, African Americans are twice as likely to die from diabetes, 60% more likely to be diagnosed with diabetes by a physician, and 2.5 times more likely to be hospitalized with diabetes and associated long-term complications, which we'll talk a little more about. 3.2 times more likely to be diagnosed with end-stage renal disease, which is a major cause of morbidity and mortality in the diabetes population. Poorly managed diabetes is what generally leads to a wide range of long-term complications of the disease. So why we care about diabetes, not just because blood glucose is high, but because it leads to these complications. Those complications make diabetes the 6th leading cause of death in the U.S., and it's likely underreported as a cause of death, because usually patients who die from diabetes, they don't always have that on their death certificates. They often have the underlying complication that's led to their death, but diabetes doesn't always make it on those. Overall, the risk for death among people with type 2 diabetes or with diabetes is twice that of people without diabetes. So that's generally the elephant in the room of why we care about diabetes so much, is because it leads to an increased risk of death. Heart disease, well, heart disease is really the main killer of people with diabetes. It's the leading cause of diabetes-related deaths, up to 65%. It increases the risk of heart disease death 2 to 4 times. Diabetes is considered a major risk factor for cardiovascular disease, similar to a family history of premature cardiovascular disease or pre-diagnosed cardiovascular disease. And the risk for stroke is 2 to 4 times higher among people with diabetes as well. Diabetes and eye disease. Well, diabetes is the leading cause of new cases of blindness among adults age 18 to 64 years old every year. About 10% of adults with diagnosed diabetes reported severe vision difficulty or even blindness, and diabetic retinopathy, or disease of the blood vessels in the back of the eye, causes 12 to 24,000 new cases of blindness every year. Diabetes and kidney disease. So kidney disease is another major cause of the adverse health outcomes associated with diabetes. It's the leading cause of end-stage renal disease. Up to 39% of all new cases can be traced to a history of diabetes. And 39% of adults with diagnosed diabetes have chronic kidney disease, including 23% of non-Hispanic Black adults. In 2019, there were 61,000 Americans with diabetes who began treatment for end-stage renal disease. So a very significant health problem. What about diabetes and nerve disease or neuropathy? Well, up to 60 to 70% of diabetic patients have mild to severe nervous system disease. This can be manifested in ways such as tingling, pain, or numbness in the feet or the hands. It can be manifested as delayed digestion of food in the stomach, which can lead to bloating or to other problems. It can lead to carpal tunnel syndrome in the hands, erectile dysfunction in males, and loss of warning signs of low blood glucose. So that's a combination of patients with longstanding diabetes having nerve complications and not sensing when their blood glucose is low, even though they may be taking medicine that causes their glucose to occasionally go too low. So that's a challenging situation that we deal with very frequently. Diabetes and amputations. Well, I'm sure you've all heard of people with diabetes who have had limb amputations, either feet or toes or even legs. That's due to a combination of factors, which includes diabetes affecting or decreasing the blood flow to the distal hands or feet, as well as decreased sensation when there's an infection in the hands or the feet. That's what leads to ulcers, infections, and eventually, if those don't heal, can lead to amputation. This risk is higher in patients who smoke. So smoking plus diabetes is a double whammy for development of these complications. And over 60% of non-traumatic amputations of lower limbs is due to diabetes, up to 160,000 amputations annually in the U.S. So I call this lecture Living Well with Diabetes. So where's the living well part? Well, let's get to that now. So people with diabetes and their healthcare providers can reduce the occurrence of complications of diabetes by controlling their blood flows tightly, by keeping blood pressure well controlled, by treating abnormal lipids or high cholesterol, taking medicine for high cholesterol, and practicing good preventative medicine. Those can all reduce the occurrence of the complications of diabetes that leads to the disease, the death, and morbidity and mortality. Diabetes and blood pressure control. Well, just by controlling high blood pressure, people with diabetes can reduce their risk of heart disease by 33% and can reduce their risk of stroke by up to 50%. And what we found in research is that for every 10 millimeter lower systolic blood pressure reduction, that also lowers the risk of any diabetic complication by 12%. So people with diabetes, it's not just controlling your blood sugar, but controlling the blood pressure is just as important in reducing your risk of heart disease and stroke. So it's really multiple things that people with diabetes need to focus on. Diabetes and blood lipid control. Well, cardiovascular complications can be reduced by between 20 and 50% by managing levels of LDL cholesterol, HDL cholesterol, and triglycerides. So it's very important for people with diabetes to take cholesterol-lowering medicine depending on their age and how what their cardiovascular risk factor is. Studies have shown that people with type 2 diabetes, adults with type 2 diabetes, can actually reduce their risk of major cardiovascular events just by taking cholesterol-lowering medicine, regardless of what their baseline cholesterol levels are. So aggressively managing lipid levels, you can really reduce those as well. And other preventative care things that I'd like to mention, regular eye exams can reduce the development of severe vision loss by between 50 and 60%. Comprehensive foot care, including proper patient self-foot examinations daily and following with a podiatrist as needed, can reduce the risk of amputations between 45 and 85%. And by detecting and treating early kidney disease, patients can reduce the decline in kidney function between 30 and 70%. So Diabetes is a disease that affects all of us. It affects multiple organs of the body. It can lead to a loss of life as well as to significant health complications. But some of these health complications can be avoided and the risk can be reduced by managing blood glucose, cholesterol, blood pressure, and other preventative medicine. So you definitely can live well with diabetes. Talking just a little bit more about blood glucose control, improving glucose control benefits people either with type 1 or type 2 diabetes, and every 1% reduction in hemoglobin A1C, which you'll probably hear a little bit more about today. Hemoglobin A1C is kind of a scorecard we use to measure average blood glucose over a 2 to 3 month period. So each reduction in A1C by 1% can lead to a 40% reduction in the risk of eye disease, kidney disease, or nerve disease from diabetes. And when we say effectively managing diabetes, glucose goals are different for everybody. I'm sure some of you in the audience have diabetes just based on the number of people in the audience, and your goals may be different based on discussions between you and your physician. But as a general rule, it's recommended that patients target a blood glucose level between 80 to 130 before meals and less than 180 after meals. For the general population, an A1C goal of less than 7%, that may or may not be appropriate for everybody. And like I said, goals may be less stringent for certain people if harms of treatment may be greater than the benefit. For example, for very elderly patients, for patients who were dependent on others to manage their diabetes and maybe can't manage it by themselves, they may be more susceptible to adverse effects of low blood glucose. So higher targets may be appropriate. The point is that it's important for you to discuss your goals with a physician based on your particular set of circumstances. We recommend that patients have an A1C check between 2 and 4 times a year, and that may need to be done more frequently when therapy changes. For the general population, an A1C target of 7 is more appropriate, but if between 7 and 8%, if your target is 7, then you should review the management plan with your provider. And if it's more above 8%, that's an indication that you need to intensify your management plan. Diabetes and foot health, really, people living with diabetes are the first line of defense in detecting foot problems and avoiding amputations. We recommend examining the feet every day with a mirror to look between the toes and underneath the feet and the backs of the foot, washing feet daily and making sure that they're dried, wearing shoes and socks at all times, and protecting feet from extremities of heat or cold, encouraging good blood flow to the feet, and of course keeping diabetes well controlled. And diabetes and eye health, we recommend annual dilated eye exams for adults with type 2 diabetes, controlling high blood pressure and avoiding smoking, seeing an eye professional for any changes, and again, keeping the diabetes well controlled.
Thank you so much. Just give a round of applause for Dr. Silver. Antoine, and just to give us some ideas in terms of the emotional and psychological aspects of dealing with diabetes.
Good morning, everyone. Can you hear me? Good morning. Hi. So I think when we're talking about anyone going to the doctor and the doctor giving you a diagnosis, especially one that you may not have prepared yourself for or you didn't know could be a possibility, just that information alone can sometimes take us back, right? And how we process it, and especially the weight of the diagnosis. So if the doctor is telling you you have diabetes, it's a bit of a blow, right? And everyone may not be able to kind of take that diagnosis and be like, okay, doctor, what's next? It's literally your life stops. And you now have to either reconsider what happens now, or some of us don't hear what it is that the doctors say, right? The doctor said, whatever the doctor said, right? And we move past it, we pretend like we don't hear it, and we live our lives. But for those of us who have had to kind of deal with the fact that the doctor just told you that you have diabetes, it may lead to you being depressed, being anxious because your life has changed. Now you have this diagnosis. It may feel like an added weight on your shoulder. And how do I navigate this? How do I now I have to plan meals because a lot of us see TV, right? We hear other people talking about things and see how their lives may change. And can I afford the copay of the medication? What medications? If you don't like injecting yourself with needles, right? All of these ideas and things are now running through your head. And how you may deal with it is it may cause some depression, some anxiety. You find a lot of times people with some more lifelong diagnoses also have a hit to their mental health. So you're dealing with anxiety, you're dealing with depression. It may not be crippling anxiety and depression where you're inside your home and you don't want to get out, but how you may move from that point of diagnosis forward is going to be different because it's a constant on your mind. If you usually maybe stop off, and I will speak for myself, you stop off at McDonald's for the fresh fries. It's like, can I now eat that? Will I be okay after I eat that? What's the consequences of eating that? Sorry, but like Dr. Huggins spoke about her brother's experience, right? If you are a neighbor or a family friend and you heard about that outcome, all of these things are playing in your mind and you're processing them every day. And it will impact your day to day in terms of how you're dealing with things. You may be a little bit shorter with people, easily irritated because now you're dealing with this thing on your back, right? This diagnosis and how it changes all of your life. If you don't exercise, and you're hearing, well, I now have to exercise, I have to plan my meals, I have to see, for instance, if you buy the Goya red beans in the supermarket, you now have to learn how to read, right? That's not on this one. You have to read the nutrition facts and understand that it is a lot for anyone to be able to go through and to hear. Most of the doctors will have a conversation with you and ask you, are you okay? How are you dealing with that? And I think culturally, if you're from the Caribbean or you're from, I'll say the diaspora, mental health issues or mental illnesses is not something you will shout from the rooftops because people will usually tell you, well, you're supposed to be able to manage your stuff yourself. So for you to go see a social worker about it or a psychologist, it's usually the farthest thing from your mind because you're supposed to be able to manage and keep your issues to yourself, not spread it out on the street and to the public. So how exactly are you going to manage it when, again, you have this hefty load of being diagnosed with diabetes? Start with talking to the doctor who gave you that diagnosis.
Yeah, thank you for that, Ms. Antoine. I would like Ms. Jean-Louis to kind of continue that trend in terms of tips for managing diabetes. Can you just give us a few tips that we can take away?
Yeah, definitely. So when we say diabetes, I'm just going to go a little bit back before giving the tips. When we say diabetes, a lot of times people have a misconception about diabetes. Even when we sit here and, we listen to a great presentation and we see the numbers on the slide, we walk away not really having an understanding about what diabetes is. A lot of times culturally, providers, at times we do a patient a disservice because we focus on saying blood sugar, okay? And a lot of times patients walk away with thinking that diabetes is a sugar, cake, candy, sweets condition. But what it actually is a blood glucose condition. So by changing the words that we use and explaining what glucose is glucose is a sugar that your body breaks down food, carbohydrates, into that glucose. So in managing diabetes, it's important to know What's a carbohydrate? Does anybody know what a carbohydrate is? Starch. All right. Perfect. Can somebody, Mommy, can you tell me an example of a starch? Rice. How many people eat rice? All right. I heard potato. How many people eat potato? I'm going to say banan. How many people eat banan? Okay? How many people eat rice, potato, and banan at the same time? There you go. You feel hurt. Okay? And many times we eat a big plate of rice, beans, and banan in the same seating. And we eat it for lunch, plantains, yuca, ground vegetables, yum. We eat that in one sitting, and we'll eat it for lunch and dinner. And for breakfast, we will have provision. We will have dumpling. We will have porridge with carnation milk and sugar and cornmeal and plantains. So an important thing to know is that with diabetes, it's important to understand that it's banan kaje mami. So it's important to understand what is it that we have to look at. So we have to look at the starch. Now, another thing that is starch is fruits. Fruits are starch. Mango, pineapple, kiwi. Give me another one. Banana. Banana is so easy. You take a banana, put it in your pocket, and eat about 5 of them a day, right? Apple. Okay? So when we're talking about that, we have to understand the group of food that we're talking about. So tip number 1, you have to know what a carbohydrate is so that you can make healthy food choices, okay? Growing up, a lot of times, in a Haitian culture, I'm Haitian, we boast about we don't eat fast food. We eat cooked food. And because we don't eat fast food, we eat healthy. And that is actually a mind concept that is keeping us unhealthy. Because we look at our food as healthy, so we don't see that it is the food that is killing us. The numbers that the doctor placed up on the board where it says 13 and 12% African American and Latina, one thing that African American and Latina share is culture, our food, our rice, our beans, our yamens, My girl hit her chest. She's like, oh my God, I can't eat. You know what I mean? And so we have to limit the amount of these foods that we're consuming, especially in one sitting. So that's tip number 2, portion control. So tip number 1 is identifying what a carbohydrate is, what a starch is. Tip number 2 is portion control. Now, anybody ever been to a cookout or a party? And then a buffet? And then what do? We fill our plate. Because it's a buffet, we're paying our $12, so we're going to get our $12 worth of food. Okay? And we're going to take something home. Okay? Portion. That $12 is going to cost you your legs, your eyes, your kidneys. Okay? So portion. I usually tell my patient, limit your plate to 1 starch per plate. What does that mean, Carine? So if you have, some fried eggs, right? And you have half of a banan, half a plantain. That's it. Don't go put the potato in there. Don't go put the dumpling in there. Don't pile up the starch. Limit it to one. If cassava is your thing, limit it to one. Okay? Can somebody tell me what they had for breakfast this morning? Banana, coffee. Anybody have bagel? Okay. Okay. So bagel is very dense. Okay? Very dense. Bread. Anybody have bun and cheese this morning? Okay? So it's very rich. I love bun and cheese. So we have to limit how much we're eating. Okay? So that's, huh? How about mai? Is mai a starch? Is mai moulin a cornmeal? That is a big starch, mommy. That is a big, yes it is. Cornmeal. Is beans a starch? Are beans starch? Yes it is. Give me another one. Pitimi. Is pitimi a starch? Yes it is. Is blé a starch? Bulgur. Yes it is. Bulgur wheat. So we have to limit it. So limit it. Is fish a starch? No. So pitimi is basically a wheat. Okay? It's a wheat. The third tip is making better options. Oxtail, is oxtail a starch? No, it's a protein. So meats are not starches. Is cheese a starch? No. Cheese is a dairy, it's a fat, okay? So identifying what it is. And these are the things that when you visit your medical provider, and I'm very happy that this beautiful lady got up and said, I need to make an appointment, because these are important things to ask your provider, okay? So that if you have a question, it's important to say, is this okay? Is that okay? Because many times, part of what is important with managing diabetes is changing our thinking about food, changing our thinking about portions, okay? And learning how it is that we can nourish our body with the food as opposed to poisoning our body with the food. I want to share a simple story that really blew my mind, and as a practitioner made it very important for me to make sure that what I'm saying is what the patient is hearing. If anybody, with getting an understanding, you have to understand. So many times what I'm saying is not what the person is hearing. So I had a patient of mine. This is early in my career as a practitioner, and she had been a patient of mine for about a year. Little old lady, cutest thing. And we over the year built a relationship. She had high blood pressure, very uncontrolled. Oh my goodness, woman was like on a pharmacy list of medications. Couldn't get this blood pressure down. She was Haitian, I'm Haitian. We'd pass on blog, tell stories and everything. She would always ask me about my son. So we got personal. And then one day she leaned over and she says, "Nurse, how did I get high blood pressure? Is it something my husband gave me?" Now we laugh, but we sometimes joke to people and say, "Oh, you're going to give me high blood pressure." So she assumed that the high blood pressure was a disease, such as a sexually transmitted disease that her husband gave her. So she never picked up the medications that were being prescribed. She came to the doctor's office to check herself. She listened. We prescribed, but because she had a misconception about what the condition was, that was a barrier that kept her from getting help. And what broke down the barrier is me and her becoming friends, where she felt that every time I tell this story, I get teared up, because you have to understand. And it is about life. So because she understood now, I said, oh my God, let me call this lady's pharmacy and cancel all these medications. One pill is all it took to get her blood pressure under control, once she had an understanding. The other part about it is compliance. There are some people that the medications, oh, I don't want to take too much medication. So we prescribe, but they don't take. We prescribe, but they don't take. I want to drink my herb. I want to drink my bush. The medications pile up. Kidney disease happens. Blurred visions happens. Gangrene happens. It's important to make sure that you understand what the provider is saying, that you understand how the medication is working. So your husband may be having some side effects with the medication, just as the doctor is saying, because he's consuming a lot of the foods that is building up sugar in his system and causing that side effect. So it's important to know how the medication works. It's important to communicate that medication. It's important to make sure that you understand. So tip number one is...
Let's hear it from them.
What's tip number one?
Hear it from you guys.
What's tip number one? What's the first tip?
No, let's
Tip number two. Tip number two. Learn what the carbohydrate is. What's tip number two? Portion control. What's tip number three? Understanding. That's what it is, okay? So those are my tips in managing diabetes, okay?
I wanted to concur. That was excellent.
Stress, as she was alluding. You know, how many people have stress in their life? Stress. Stress, stress, stress. Stress does this horrible thing in our body. It releases a hormone called cortisol. Okay? Cortisol can increase your blood pressure, increase your blood sugar, prevent you from being able to lose weight. Stress can affect your mind. So, mommy, yes. Can being anxious increase your blood pressure? Yes. Can being anxious increase your blood sugar? Yes. Absolutely.
Hello, good morning. Buenos dias. So for most people, I'm not born in America. I was born in Puerto Rico. I was born on a small island, very, very inclusive, very culture-based, everything. When I came to New York, I was about 5 years old. My diet has changed tremendously because I know as a Caribbean, we eat a lot of fast food-based diets. I love empanadas. Pastelillos is the same thing. We love our fried fish and everything. I was diagnosed with prediabetes around middle school time when I was a lot younger. I had to learn how to change my eating habits. My mom was not a fan of that. My mom was very much, you're fine. As long as you're not diabetic, you're fine. No, I had to educate my mother on the severity of it. My mom was very much, here's a plate of food, cómetelo, eat it. Everything is eat it. Don't worry about it. You don't have to worry. I tell you, don't worry about the doctor, what did he say? You eat the food. However, my diabetes got worse and worse. So my current A1C level is 5.7. I'm on the border. If it goes up, I'm diabetic. If it goes down, I'm decreasing my chances of getting more closer to diabetics. So I had to learn how to say no to my mother.
That's fine.
My mom did not like that. Not at all. My mom does not like being told no, especially about her food. But then my father got diabetes. That's when my mom was like, okay, I think we should change up here. My mother also was diagnosed with prediabetes herself. It's a generational thing. My whole family has, especially on my mother's side, has some sort of diabetes. So I had to learn how to exercise more. I had to learn how to stay active in school and even outside of school because I was a mama's girl. I was not allowed to go out by myself. Obviously, I could not go out with my friends. So I had to learn how to do exercise in my house. Obviously, over time, I had to learn how to manage it. However, it's really hard. But we have to understand it would be better to understand how to manage it at a younger age, especially if you guys have family members that are young. You have to learn how to educate them to understand, even though it's our culture, even though our culture is fried fish, having plátanos, plantains. My favorite is surullos. I don't know if anyone here knows what surullos are. They're like corn flour type of base. You fry them with sugar.
You do have it.
Oh, Lord. The worst thing to eat as a pre-diabetic, but I love it. But we also have to understand it's not getting rid of it entirely. Understanding portion control, as how she stated, is the most important thing. I do not push myself away from my favorite foods. I still eat fried fish. I still eat surullos. I still eat plátanos. I still eat empanadas. I still eat all the foods that I love to eat. It's just understanding that, okay, if I have this right now, I cannot have something later that has something within that category. There is a lot of self-control. There's a lot of self-control. It took me a really long time. And even as an adult, it's even harder because now I have access to my own money. I got access to my own money and I love pastelillos. So having the ability to self-control and understand to manage, okay, well, for breakfast, I'm going to eat this because maybe later that day, my mom might be making pastelillos. Okay, I'm not going to eat anything fried until later in the day. Nothing that has to do with a lot of sodium, a lot of starch, nothing like that. Okay, I'm going to put it away, but I'm going to eat that later. It's like a reward system. And not eating something now, but understanding the concept that you might be able to eat it later can manage it. It can actually prevent it from getting worse. So just understand that you don't have to step away from your favorite things, but understanding, okay, saying no to yourself and saying no to your loved ones is very important for your health, especially with diabetes.
Yeah. Thank you. As we wrap up, I just want, is there any additional information or last words so that as our audience lead, that they can keep it along with the 3 tips that you gave?
I don't know how familiar people are with the 988 phone number. That is, I think, the entire U.S., but more so based in New York. The ability to call 988. It doesn't have to be an emergency, but if you need someone to talk to. It's not something that you have to pay for. Sometimes we don't want to speak to our family members, we don't want to speak to friends. But if similar to 911, not 911, but 988 connects you to someone that you're able to speak to in the moment about whatever it is that's going on. I highly recommend just as a resource. I know within cultures it's stigmatized to talk to other people other than your family members about anything that's going on. But sometimes we reach a place where it's too much, or possibly before it gets to too much, that there is a free resource. Again, you could pick up your phone and dial 988 and you'll be able to speak to someone confidentially on that line.
Okay, thank you. That's a great addition. Anything else you want to just close with? Well,
The main thing that I want to impart is get your health screening. And don't bury your head in the sand. As you know, this young lady courageously gave her story. You know, it's important to get checked, take it seriously, and get an understanding.
Thank you. Anegelica.
Yes, before I leave you guys as well, the importance of understanding what diabetes are and understanding what things we can do to prevent it is very, very important. It's, please, as she said, go do screenings. I do my screenings twice a year one in the beginning and one in the end, to make sure that, let me see if my A1C has went down, has went up. It's very important to also have a support system. Have people as your friends, your family, co-workers, does not matter who. Somebody that's willing to help you change your eating habits is the best thing that you can do, is have that support against fighting with you to eat your favorite foods, sadly. But it's important to make sure you understand that.
Okay, thank you. Please give our esteemed panelists my brothers college, thank you for coming here.
Good afternoon. Good afternoon to all. My name is Conrad, and I'm here. I want you to see me, a diabetic. And I remember when I was first diagnosed as a diabetic, it was a shock. But there were certain symptoms that I was experiencing which I could not identify with diabetes. For example, I was just so thirsty all the time. I was urinating frequently. When I say frequently, the quicker I drink water, the faster I have to urinate. So I spend most of my time standing next to a bathroom. But anyway, and then I saw the doctor. He did his test and he said that you're diabetic. But 6 years before that diagnosis, I was warned that I was pre-diabetic. Yeah. And I just totally ignored the warning from the doctor. Now, had I listened and followed the dietary recommendations and doing the things that one can do to prevent that, I probably will not be standing here today. But I'm standing here today to let you know that you can live well with diabetes. You have to learn to live with diabetes. They were speaking about the diet and your blood sugar. I got into the habit of religiously taking my blood every single morning for the past 14 years. About 6 months ago, I switched to what's called a 24-hour glucose monitor, which is right here on my arm, and I can monitor my blood sugar 24/7. So I asked Dr. Hall, why is my blood sugar spiking at midnight and 1 in the morning, hours after I've eaten? And he said, well, what really happens is that the nurse was talking about the carbohydrates. Sometimes it remains stored in our body. And whilst we are asleep, it releases the glucose. So as much as I try to cheat, or we try to cheat and, eat too much rice or eat too much pasta, it catches up with us. So it's very important for us to pay a lot of attention to our diet. Exercise is very important. 5 years ago, I started running. Not competitively, but just running for my health, to help my diabetes. I joined a running club. When I joined the club, they wouldn't allow me to run because I was so bad. I had to walk. So and that's a true story, after a month and a half, the coach said, okay, you can start running. My first 5K, which is 3.2 miles, it took me 2 hours to run 3 miles. Now I can do it in 45 minutes. So I'm saying all of this just to bring to your attention the importance of exercise. But in that process, I fell in love with running. So as a result, I run a few times every week. I've completed 3 New York marathons. And it's something I never thought I could do. So I'm here just to emphasize again, yes. Well, there's one other thing I want to share. I remember also what happened to me when I was first diagnosed. I was like ashamed and embarrassed, because of the stigma that comes with being a diabetic or being sick So it took me a while as my health was not getting better to accept diabetes and accept the fact that I'm diabetic and accept the fact that I can do something to help myself and live a healthy life with diabetes. Thank you very much.
How many of you enjoy?
Please join Medgar Evers College Transition Academy to combat student hunger. For more information, please contact Transition Academy at 718-270-6988. That's 718-270-6988.
This broadcast of Education and Perspectives is paid for by Medgar Evers College.